Hello, friends, and welcome to the world of health. In ancient times, there used to be weird treatments to reduce the headache which people experienced. In some cases, people used to believe there is an evil spirit which is now stuck in the head and that this has to be brought out of the head. And for this, they used to drill a hole into the skull and let the blood come out. Thankfully, we don't have such sort of treatments available now. But still, headache is one of the most common type of pains which a human being ever experiences. But in spite of its commonality, many patients find it difficult to explain the kind of pain they have, the kind of headache which they have. And for this very purpose, I shall try to explain what is a headache, what are the different reasons for headache, what are the different types of headache. Because when you know the type of headache you are getting, you will be able to explain it properly to your doctor, and then your doctor will be able to give you a much better prescription. So do stay with me till the end, because at the end I'll be sharing some fantastic homeopathic medicines which will be giving you immediate relief. Headache is a pain which person can complain of anywhere from the upper neck to the head or somewhere in the face. Now this could be present in the whole head or only in some parts of the head. So like people complain of pain only in their temples or on their top of the head, which is the vertex, or in the back, or only in the forehead. So accordingly, the diagnosis and the treatment shall change. Even the pain which people experiences varies from person to person, because some people there will be a burning kind of pain. In some people they would be having a sensation as if somebody is hitting their head with a hammer. Somebody has a pain which is coming from inside out. Somebody will be having a throbbing kind of pain. So there are many different types of pain. In homeopathy, there are more than 767 different types of descriptions based on which the homeopath can identify the most accurate medicine. So let us understand this headache. So how many types of headaches are there? Broadly, there will be two types. One is the primary kind of headaches and the other is the secondary. What is the primary headache? Primary headache is something wherein you do not know the reason why this patient is getting headache. So there is only headache and no other disease. So we'll come back to the primary headaches after some. So what is a secondary headache? Secondary headache is something which is a symptom of some other disease present in the body. So the secondary headaches are something which have a clear-cut reason. This could be because of a tumor present in the head. This could be because of an eye problem, because of a heart disease, because of a gallbladder disease, because of the alcohol which he has taken, because of some medicines which he has consumed. Now, according to the reasons, the scientists have identified more than 150 diseases which can have headache as one of their symptoms. So these are the secondary headaches. For example, sinus headache is there. So we'll understand this thing. So what is a sinus? Sinus are the spaces present inside the bones of the skull, especially in the forehead, near the cheekbones, or in the nasal bones. Now what happens? These are hollow spaces. Everybody has these things. They are very important for our normal speech and normal movement of the head. But problem starts when these spaces get an infection. Normally these spaces are hollow and very little amount of mucus is present. Now when an infection is there in these sinuses, the body's immune system starts two kind of reactions. One, it will increase the temperature near the sinuses so that the bacteria or whatever which has entered into this place, that could be killed. The other reaction is the sinuses will be producing much more amount of mucus. So this is in the idea that it can flush out the foreign particle which is now inside the sinuses. But because of the extra mucus, the sinuses get filled up and the sinuses get heavy and distended. That is why a patient who is having sinus headache generally has a heaviness of the head. Now because of the increased pressure inside the sinuses and because of the increased temperature, this patient will be having a pain in the head. Now this would be generally of a throbbing kind of pain. No matter what kind of painkiller you give this patient, this pain will keep recurring until and unless you address the infection present inside the sinuses. And whatever dietary suggestions or whatever precautions like taking steam and other kind of precautions which are there, those things will also help the patient and those things will change according to the reason. Now let us come to the primary kind of headaches. Primary kind of headaches are just standalone headaches. They are not a byproduct of some other disease, like it was the case in the secondary headaches. So why do the primary headaches come? We don't know. Scientists are still in search of it. But we can broadly classify the primary headaches into three varieties. One is the migraine headache, then is the cluster headache, and lastly the most common type of primary headache, which is the tension headache. Many people generally assume that tension headache is because of the anxiety and tension which they take. Yeah, that could be one of the triggering factors, but that is not why this headache is so called. This headache is called as a tension headache because this patient has a sensation of a tight bandage, as if somebody has tied a rope or a belt or a ribbon, some part of the head, and somebody is pulling it tight. Now, because of this tight tension which the patient is experiencing, something is squeezing it. That is why it is called as a tension headache. Now, this is more commonly seen in the teenagers and in the young adults, and generally this pain would be mild to moderate. Generally, tension headaches are not seen in a very severe state, not so severe as to prevent the normal day-to-day function of the person. Tension headaches do not have any other symptom apart from the pain. Then come the migraine headaches. Now, migraine is something which is much more popular as a headache than any other kind of thing. Generally, this would be seen on one side of the head. Migraine headaches generally last somewhere between 3 hours to 3 days, and this could be repeated maybe 3 to 4 times in a month. So, why? We don't know, but generally, along with this headache, a migraine patient will also be having a few other aggravating or ameliorating symptoms. Like this patient's pain will be increased by looking at a light. So he would want a dark room, or he would want it silent because sound or noise is aggravating his pain. It is possible that the patient has vomiting sensation, that is nausea, or he might actually end up vomiting. And in many cases, especially in the younger children, they complain about a disturbance in their stomach, a sort of an indigestion kind of sensation along with the headache. And in some patients, there would be a kind of aura kind of sensation. Aura is something which is present before the headache starts. So they might be seeing some flashes in their vision or some geometric patterns in their vision field. So all of these are some of the symptoms associated with the pain in the headache of a patient of migraine. Why? We don't know. Then come the cluster headaches. These are the most severe kind of pains which are seen in the primary headaches. Generally, the cluster headache, the pain is of a burning kind of sensation and as if somebody is stabbing or poking into the head. This is most usually found associated with one eyeball. So it could be around the eye or behind the eye. And from there it will be going to one of the parts of the head. It could be going back or to the top or someplace. And it is also observed that the side on which the pain is there, that eye will tend to look reddish. The eyelid would tend to drop. There could be some lacrimation, that is water coming out of that eye. Now, why is this called as a cluster headache? Cluster means a group. Now, this headache comes in bundles or clusters. A cluster headache could last somewhere between 15 minutes to 3 hours. And this could be repeated 4 to 5 times in a day. And like this, the patient can have episodes or bundles of these sort of episodes lasting for maybe 1 month or even up to 3 months. And suddenly the episodes stop with or without treatment. And this interval could last somewhere between a few months to a few years. And then as abruptly as they have stopped, these headaches will again start. So why did they stop and why did they restart is something which we do not know. But these tend to come in bundles, and because of the severity, these are the most difficult ones to treat because sometimes these might require hospitalization as well. So whatever be the kind of headache, it could be primary or secondary, there are many factors which tend to increase the headache or in some cases decrease the headache. Some situations, some phases which would aggravate the headache. Say for example, a patient could have more headache after sex or a physical activity or a throat infection or an ear infection or certain types of fevers. For example, in meningitis, along with the headache, there would be a stiffness of the neck and photophobia. So other symptoms will be there. In some females, especially, the headache is connected to their menstrual cycle due to the hormonal changes. So, this headache could be there before their menses or in between two menstrual cycles during the time of their ovulation. In some patients, this could be triggered because of the meals which they have skipped, in some cases, because of a food poisoning. In some patients, because of the environmental changes like rain or sun, and in some cases, because of the thunder sounds. In some patients, even changing sleep patterns, like somebody who has got insomnia could also complain of headache. In some cases, this could be because of the genetics. If a child has a much higher chance of getting a headache if his parents have the tendency of getting headaches. This could be because of the bad posture which somebody is adopting, like in the software professionals, wherein because of the bad neck posture they end up getting headaches. And in some patients, the description of the headache will also vary. Some patients will feel comfortable when they close all the doors and windows because the air is not making them comfortable. And the exact opposite is seen in some patients. They feel much better when they go and stand in the open air. In some cases, the pain comes from the back to the front, and in some from the side to the side. So, depending upon the reason, we can identify the most accurate homeopathic medicine which is suitable for this patient. And such a perfectly identified homeopathic medicine will give instantaneous results. So, I would generally suggest all my viewers to please visit your homeopathic physician, who will be taking a detailed case taking and then come to a conclusion. For example, if somebody is having headache because of a couple of sleepless nights, to reduce the headache, Passiflora 30, 5 pills every 1 hour, that would instantaneously reduce the pain within 3 or 4 doses of taking this medicine. But if somebody is getting headache because of getting dehydrated by getting exposed to the sun, then Passiflora will not help them. Glonoin 30 will be the most accurate medicine, and here the medicine has to be taken 5 pills every half an hour. Within 4 to 5 doses, the pain in the head will be reduced. And the same patient, if he gets headache because of getting dehydrated after taking too much of alcohol, then Glonoin will not be able to help. For them, Nux Vomica 30 would be the best medicine. So like this, if you are able to clearly tell your homeopathic physician the exact kind of pain, the exact things which are increasing or decreasing your headache, or the exact reason why you are getting headache, the medicine will be instantaneous magic. But let us assume you don't have a good homeopathic physician near you, or that you are not able to identify the pain. I will be sharing a combination with you which you can use to reduce the pain. I would like you to take 10 ml of Belladonna mother tincture, 10 ml of Chionanthus mother tincture, and 10 ml of Iris versicolora mother tincture. Mix all three together in a 30 ml bottle and use 15 to 20 drops of this combination mixed in half a cup of lukewarm water. Repeat the same thing every half an hour. And generally, after 2 to 3 such doses, majority of the varieties of headache will be subsided. And I am repeating myself again, for long-term results, please visit your nearest homeopathic physician. If you have learned at least something in this video, do press the like button. And if you're coming to this channel for the first time, don't forget to subscribe and press the bell icon, because you will be notified every time we come up with a new video. And if you have any further doubts, don't feel shy to post it in the comment section. So this is Dr. Suresh Soumyajula signing off for today. Sarve Jana Sukhino Bhavantu.